How you doing? Dr. Brad Murray, High Performance Health. Today we're going to go through a drill that's going to help you with the common shin splint problem. Often the shin splints are caused when there's an inadequate balance between the muscles on the inside part of your lower leg and the outside part of your lower leg. If I'm to take this guy and we're to think of these muscles as your peroneals or fibular muscle group, and this muscle is your tibialis posterior, what happens is when this muscle contracts, it brings the foot in and up. And when this muscle contracts, it brings the foot out. This muscle, the tibialis posterior, actually acts more to support the arch. So every time that foot comes down, the arch doesn't collapse and it drag your knee in. Really important for those people that tend to have that collapsed arch, that knee collapsing medially with your squats when you run, when you jump off a box, and those knees come in. Really important to have that support of that arch on the foot so that knee's not collapsing. I'm going to show you a nice simple drill that's going to work that tibialis posterior muscle, or the muscles on the inside part of your leg, to help support that arch of your foot. You're going to start with this guy, the mini band, the staple. Everybody should have one of these guys. You can throw it in your bag. You can do all kinds of drills with this. Really cost effective as well. You're going to get the mini band around your little toes on your feet. Make sure it's flat. The next thing that you're going to do is you're just going to cross that leg up and over and rest your ankle on your thigh. Really comfortable position. If you're really noticing that your knee's really up and you're not able to get it down, that's probably an external rotator problem within your gluteals that you may have to work on. From this position, you're going to want you let your foot totally relax. Let that mini band pull the foot all the way down. You should feel a minor stretch through here when you're in this position. Next, you're going to bring that foot up. Make sure this is right over the ball of your foot. You're going to bring that foot up, and then you're going to actually assist in bringing that foot all the way up. Once you're pivoting through that ankle, you're all the way up, you're going to release, and you're going to try to hold it there for 2 to 3 seconds. Then you're going to slow and controlled let that ankle come back down. Once again, you're going to roll that ankle up. You're going to assist it to come all the way up and in. You're going to try to hold that position all the way up for 2 to 3 seconds, and then slowly lower this. This drill is really challenging. You're going to feel a lot of stress through here. Really important that you're able to hold this position up. This is what your foot does, is it acts eccentrically to stop that arch from collapsing as that foot comes down. This is the area we want to train. We want to strengthen that muscle so it's not tugging on the bone and using it as a sling, so we can have you get away from those shin splint type problems. This is great for medial lateral stability of your ankle as well. Ankle inversion, tibialis posterior stretching, strengthening, give it a try.